Polycystic Ovary Syndrome (PCOS) affects millions of women worldwide, disrupting their reproductive health and overall well-being. According to World Health Organization, the multifaceted hormonal disorder affects 1 in 10 women worldwide, leaving 70% of sufferers undiagnosed. Despite its prevalence, there remains a lack of understanding and effective treatment options for many women battling this condition in Nigeria.
I started having complicated issues. One of it was that I had it aggravated into diabetes. So I had to manage my sugar levels as much as possible. And that is when it's not properly managed. And at the point where I found out that it could aggravate into diabetes, that was when I took a hold over my health. Now, the issues is that when we go to some hospitals, especially hospitals that the gynecologists are men, sometimes they don't kind of relate very well with us. They just give us metformin or they tell us to do all the various tests. I did a lot of these tests. I did HSG test to check if my fallopian tubes were blocked. I'm not saying that male gynecologists are not good. They are good. They are awesome ones out there. But I prefer if they are more females. But having a woman, it was kind of relatable. I feel that there should be more awareness.
In light of these challenges, a growing movement is emerging to advocate for better treatment support for women with PCOS. Leading this charge is Doctor Nwakanma-Akanno, an advocate for women's health in Nigeria.
PCOS affects women of reproductive age, that's between 15 to about 44, 49. And it's very important, very crucial that it's diagnosed early, because the longer it's delayed, there's delay in diagnosis, the more likely you're going to come down with complications. And it's underdiagnosed mostly because there is poor awareness. There's lack of sensitization to this issue. There's just generally poor research around women's health, poor research around what affects women. Because if there's more funding, more research, thrown into women's health issues, I think a lot of the issues that affect us wouldn't be in the dark. It would be quite obvious. And by now, we wouldn't be saying risk factors. We would know for sure. Is there a cause? How do we treat it? And it will remove that stigma, that shame, because, awareness is being brought to it.
Despite the laws mandating medical personnel to deliver healthcare services with skill, safety, and ethical standards, analysts say that medical negligence and wrong diagnoses have risen in Nigeria, and regrettably, many cases of wrong diagnosis go unreported.
Women in Nigeria should have access to adequate PCOS healthcare as much as possible, and it should be easily diagnosed. I believe that every PCOS patient or potential PCOS patient should be treated uniquely. Don't just throw metformin at us. Yes, we know, and that is one of the complaints that a lot of people with PCOS complain about. You just throw metformin. So the doctor should even be able to give not just medical advice, but direct them to a registered dietitian or a registered nutritionist that can give the best health and food advice. Because the truth is, apart from medicine, food is one way you can combat PCOS. And that is one of the things I feel I did not get adequate care from until I had full-blown diabetes.
It's not like Nigeria doesn't have good policies, but we have an issue with implementation. So we need politicians who prioritize women's health care. And I also believe we need more female representation, women representation in politics, not just women who just go there to occupy spaces, but are actually taking the bull by the horn and leading conversations around women's health care. And then education and advocacy is one of the tools that we have to keep leveraging to ensure that more people are aware about this condition and more women are empowered enough to demand their health rights. We have the Patient's Bill of Rights, and a lot of Nigerians don't know what the Patient's Bill or what their rights are. So they need to be sensitized on what their rights are and how to go about demanding for their rights. And I think when healthcare professionals are held accountable, we're going to be seeing less people who are nonchalant about their jobs.
The challenges faced by women with PCOS demand urgent actions and attention. Activists say that there is a need to strive for a future where PCOS no longer poses a barrier to women's health and well-being. Eloho Otugo, Arise News.